Hello, everybody. How are you today? Just thank you for joining us at this another great partner webinar that we have set up today. It's going to be very informative and something that's close to many of our hearts with spinal cord injuries. Urology is a big factor in our lives, and you have said that over and over again in many patient preference studies and surveys and such. We're very happy to introduce to you Convatec, one of our greatest partners and new partners this year. And they are going to provide a great educational tool along with some personal experience from some of their patient advocates. Today's webinar is entitled Catheterizing with Confidence, Comprehensive Resources for Intermittent Catheter Care. And I'd like to introduce to you today some of our guests, and then I'll pass it on to our host. Today we have Morgan McDowell, who is from working with Convatec, and Morgan is a nurse and practitioner for a urology clinic in Central Health in Lynchburg, Virginia. Then we have Lisa Morgan, as well as a neuroscience clinical specialist nurse with Rush University in Chicago, Illinois. And we have two great patient advocates, Bill Vertag and Steve Kierle, both great patient advocates, so you'll hear from them today. Feel free to ask so many questions if you could. Put them in the chat, and if you have to, you can raise your hand. There'll be different parts of the conversation where we'll break for Q&A, and we'd love to hear from you. Here's a great opportunity to access some great expertise and some of the patient advocates and what they have to say. It's going to be a great action-packed, information-full hour, and we look forward to moving forward with you. I should remind everybody that after this, all the people that have registered for this event will receive a copy of the webinar via a link, and then eventually this link will be put up on our website for the public to see as well. Without further ado, I'd like to introduce to you our host, Rachel Kaminsky. Rachel will be presenting today's webinar and is a certified wound, ostomy, continence nurse, and works as a medical affairs lead for Convatec. Take it away, Rachel.
Thanks, Barry. Okay. Can everybody see my screen?
Yes, thank you, Rachel.
Okay, great. Let me just shift this over. Okay, perfect. So we're going to go ahead and get started here. We're really excited to introduce a new program that we have coming out from Convatec. It's a Me Plus support program. It's not launched yet, so you're getting the first sneak peek at this. Barry was so kind as to go through introduction, so I'm just going to kind of breeze through. We do have some disclosures here, obviously, so I'll let you take a look at that. I'm not going to go into too much detail. And we're going to go ahead and get started. So just to give you a little background, we are a group, I have worked with a group of international experts in continence care, urology care from multiple backgrounds, and wanted to do something that we felt like was going to have a big impact on the intermittent catheterization community. And so we, together with the authors that you see on this list here, developed some international intermittent catheterization clinical practice principles. And we thought that we were done with the project at that point, but what we realized is that there's much more need and we needed to go a little bit deeper. So we're going to talk about these intermittent catheter clinical practice principles, as well as some of the tools that have been a resultant of these meetings and this project. So to begin with, like I had mentioned, the IC clinical practice principles, the purpose was really to develop, it was developed by a panel of international experts in urology and continence care. We know that if patients are not informed, motivated, and engaged in their own care, they risk lapsing in their routine or even abandoning intermittent catheterization altogether. So we wanted to create a comprehensive program for all intermittent catheter users, regardless of race, age, sex, or diagnosis. And in our search, what we found was there really were some great resources for certain populations, like, for example, the spinal cord injury research advocacy course offered by NASCIC. If you haven't checked it out, I would highly recommend that you do. Overall, though, in our search, in our literature search globally, what we found is that there were a lot of gaps in current clinical practice. It really highlighted a need for guiding principles to ensure appropriate engagement of individuals performing IC. And so our main goals were really to promote quality of life, foster shared decision-making, and informed consent. And we wanted to do that in three main areas in creating these principles. The first was the pre-treatment phase. That was the first time period. We also saw a big lack and need in initial catheter selection. And then follow-up after someone has been taught how to catheterize, it was really lacking. There wasn't a lot of follow-up. There wasn't a lot of guidance for users or healthcare professionals. We went ahead and created these principles, and you can find these principles on any of these sites. I think they all have them up now. We did seek endorsement from many different professional organizations, and we're still seeking endorsement. And so far, these are the different professional organizations and charities that have decided to go ahead and endorse the principles as really the standard of care at this point. And this is really the foundation of our program. So what you're going to notice on this next slide is it's extremely busy. We really built kind of a massive program here. But at the heart of it, you have the intermittent catheter clinical practice principles. And then you also will notice that we have a user track and we have a healthcare professional track. And so we didn't want to neglect the user in all of this. I think oftentimes the programs that you've seen or information that you've seen in the past is all really geared towards the healthcare professional. And the person actually using the catheter kind of gets left out. It's not really addressed as much. There's materials, but nothing that specifically addresses every aspect and helps take them along this journey. So we're going to go and break this out into three main areas as we kind of go through. We have the pre-consultation phase before you're actually seen and told that you need to catheterize. We have the patient consultation phase, and then we have ongoing support. As we go through this program, note that we offer both written material and online material to meet various learning needs. And we really want to have that shared decision making. This program was designed to be comprehensive, but I'll be honest with you, as we started to create this program, we discovered that we really needed to make it very practical for use. If we gave individuals a ton of papers, they weren't going to read it. There's plenty of guidelines out there that offer very comprehensive, detailed instructions, but they're not always followed or used because they're so lengthy. So we took a comprehensive program and then we refined it further and made it more practical. And it's designed to really cover all aspects of intermittent catheterization and easy to implement. So you'll see, we're going to kind of go through the intermittent catheterization and you making intermittent catheterization work for you. Those are both on the user track. And then we have the consultation, consideration, and guidance for IC for healthcare professionals. So the first tool that we're going to kind of talk through, and it's important to note that all of these tools make up this entire IC program, but all of these tools can be kind of picked and chosen based on what that individual need is at the time. This is a tool that was designed for the user of intermittent catheterization, and we recognize that it's not going to be practical in all situations, but in an instance where maybe a healthcare professional knows that they're going to be teaching intermittent catheterization prior to the patient coming into the office, this is a really great tool that they can provide to the healthcare professional can provide to the IC user to gather some basic information that's going to help with the assessment portion for the healthcare professional. So it asks the user questions about their lifestyle, their urinary history, their experience with catheterization. It's really a great opportunity to list concerns and thoughts the user may have and take with them on that first visit. It's meant to assist in communicating thoughts, feelings, concerns to the healthcare professional prior to IC teaching. And it gives the user an opportunity really to kind of take a look at the information in advance and make sure that they are starting to formulate some of the questions that may occur when they have that visit. Another tool that we have is making intermittent catheterization work for you. So this was really developed, and this is again designed for as a user tool when appropriate to be utilized. And it's really developed because so many users told us they didn't know what to ask prior to their first visit. They were overwhelmed during the visit with all of the instruction and things they needed to remember. So this tool advises them to take notes, maybe have a caregiver join them on visits as a second pair of ears. It gives them some tips and tricks to familiarize them with the language and the catheter feature so they can ask the appropriate questions, and to mention to their healthcare professional some of the lifestyle considerations that maybe aren't always considered prior to. For example, maybe this individual has a busy schedule with children and they have a very hectic morning getting children on the bus to school. So they may want to mention that to adjust the timing of their schedule. Just as one example, it really helps them to guide to choosing a catheter, adaptive equipment options, and lifestyle considerations. Now, for the healthcare professional, we've developed this consultation considerations and guidance for intermittent catheterization. And really, this is for the healthcare professional. And we're in a staffing crisis in the United States, and we're finding that oftentimes the turnover rate is really, really a fast turnover rate. And not everybody is always has a history of working in urology, and training seems to be shortened. So this is really a guide to help clinicians in training considerations and follow-up. It covers catheter design, it goes through tips, catheter material, lubrication and their uses, storing of catheters, traveling, positioning, adaptive equipment, and the follow-up. So it's something that could be used as a tool to help train new staff on intermittent catheterization, things they need to consider and think about. The second phase that we have is the patient consultation, and we have a couple different documents we're going to go through here. And this is when the patient's actually in the office. And so this part of the program for the healthcare professional really focuses on the intermittent catheterization consultant checklist. This checklist is kind of the holy grail, if you will, of things that should be done when you're teaching any patient how to intermittent catheterize. And all of our tools, and when I say we made them practical, they're really down to just 1 or 2 pages. Sometimes it's just the front and back of a page. So we tried to keep it concise without having to cut anything. It covers assessment, consent, before the training, how to narrow down catheter choice specific to the user and their needs, and how to tailor that training. And then during patient training, the choice of catheter technique, emotional considerations, and then after the training, it addresses when you should follow up with that patient, what to expect, catheter diaries, and referrals. So a lot of our MAs and nurses that we've spoken with, and nurse practitioners and occupational therapists, have said that they are willing to use this not only on a daily basis, it could become part of the chart, but it's really something that they're going to utilize on an annual basis to do their staff competencies. We also offer online quick guide, and this is something healthcare professionals and users alike can use. It's an online quick personalized guide. It is brand agnostic, which I think is really something great that Catheter did. We recognize healthcare professionals' needs, and although we work for industry, we don't know what catheter is going to be best for that patient at that time. So this is a brand agnostic tool that healthcare professionals can use. It's 5 steps. It keeps it very simple: how to prepare themselves in an environment, how to prepare the product, insertion and voiding, removal of the catheter, and disposal. We have an emotional well-being, and I'm not going to go into too much detail on this because there is the second part of this. I will kind of go into a lot more detail after we have some questions for our panel. But something that is often overlooked is the emotional well-being of the person that's having to catheterize. We've created this tool really for healthcare professionals, and this is a guide to help them, gauge the current stage that the intermittent catheter user, the patient, is at. And it's a simple method of ask, validate, and empower. So we've got this basic framework, and it actually gives a guide for the clinicians on what to ask, and then what to do with the information once the patient or user answers that question, and then how to empower them to feel stronger and more confident in their living with the catheterization. So for example, I'll give you an example. One of the first things that we advise to ask is, on a scale of 1 to 10, how on board or confident are you in your ability to self-cath? Ask that to the patient. Depending on how that patient answers, there's a scale of, if they answer 0 to 1, we have talking points and things to say that will help prompt and further that conversation and help validate their feelings. And then the empowerment part is, providing some feedback and some resources to allow that conversation between healthcare professional and user to kind of go a little bit deeper. We'll talk a little bit more about this later. The last part is the ongoing support. And again, we have tools for both the user and for the healthcare professional. But basically, we recognize that a basic introduction tool was helpful that they could send with the patient home. So it goes through anatomy and physiology of the GU system. It stresses the importance of catheterization and potential risks. We also have a top 10 pamphlet, a trifold pamphlet that can go home with the patient. It has the top 10 frequently asked questions of users that we've gathered. We interviewed many people who are currently using intermittent catheterizations in the early phase and in the later phase. And so it's designed to answer those questions. Maybe your healthcare professional already answered them for you, but you've forgotten. So it's really kind of a nice guide. But we recognized when we started to compile this list, we actually got a list of over 70 questions from users. And so we went to the evidence to provide answers for this and tried to provide evidence-based answers. And so online, there will be the full 70 questions that a user can go to or a healthcare professional can go to. But we wanted to make sure that we had the top 10 in a simple to hand out leave piece. And then we have a personalized video guide. And this is really where you can get a little bit more specific. So there's information on there, ways to reduce risk factors for UTI. We also have these personalized video instructions with several iterations. So you can choose the position that you're catheterizing in, whether it be standing in a wheelchair, sitting, if you're a male or a female. And then there's also a relaxation center and education library to kind of help with, relaxing those muscles to make catheterization easier and helping deal with some of the stress and anxiety. There is, I will say on this, there is some Comatech specific video guides in there as well. But we also, like I had mentioned earlier, offer a brand agnostic tool as well if preferred. And then again, the emotional well-being modules, this is an area that we found that is really just not even talked about in intermittent catheterization. It's kind of ignored or just not mentioned. So we do have a comprehensive 10 user-focused online modules and workbook designed to build confidence, reduce fears, and overcome intimacy issues. And this was designed by Dr. Sula Windigassen and a few other colleagues. So we'll get into this a little bit more detail in the next section as well. So this is really a point where we're going to take a break here, and I'm going to pass it back to Barry. This is the overall education program. And Barry, I'm going to pass it to you. And if you want to, maybe ask a few questions of the panel before we move to the second part.
Sure thing. I just wanted to let everybody know that there is a lot of information here. And yes, again, this will all be made available after. This is fantastic stuff. And being a person of 37 years injured, I wish this was around back then. I think we can all recognize there's a common factor here that we're just not getting enough information at the beginning of our journey. And I thought I'd call upon our two advocates, Steve and Bill, and just to comment maybe briefly on how to let people know that they're not alone in not knowing all this, and how you've sort of found your way through this. Maybe Bill, you can take it off, and Steve, I'd like to hear from you.
Thank you, Barry. And I'm going to start it off by jumping on board your statement of, you're injured longer than myself. I'm injured 25 years. But though rehab times were longer then, I was in, just thinking about it now, I was in over 3 full months. I still did not get any kind of level of instruction detail like this at all. And pretty much had to figure it out the hard way, piece by piece along the way. And, that took, frankly, many years. I think what I'm seeing here so far that Rachel has presented is the extensive Q&A information is going to be very helpful. The multimedia presentation, I think, is helpful too, because different people get things better in different ways. I'll pause there and let Steve join in.
Yeah, I think Barry, Bill, I think you both hit it right on the head. I think we've certainly come a long way. I was hurt 36 years ago. I have a C6 spinal cord injury. And, along the way, there was kind of a quote that I just repeat in my head. It's, don't let a momentary failure deter you from trying to work to figure it out. And, especially with no hand dexterity, that was something that took me quite a while to figure out. I did it on my own because, unfortunately there was not the peer groups or the support groups or panels like this. This is amazing. that we have this forum to discuss this. But I'll just say that, it was a lot of trial and error and working through the process, and over time meeting with other people, collaborating just by chance. So again, it's great to have this forum to learn from each other.
I'd like to pose this question to the panel, and I'll have to tell you right now, and I keep going on about this, but this is incredible information. And as we all know that, you'll hear from our advocates later on that every journey is different for every individual, especially with the spinal cord injury. And unfortunately, things do change. But I was wondering, this information that you pulled together is fantastic. What is the interaction like with urologists out there? Because I think our advocates would agree that sometimes we're going in, speaking to urologists and educating them on sort of the nuances of what's happening. Yes, there's the science and medical science behind what we should be doing. At the same time, there's the practical side. And I was just wondering what the panel does in terms of engaging the urology committee, if there is some sort of interaction.
I'll jump in, Barry. And thinking back, and again, a week over 3 months spent in rehab, I really did not have a relationship with a urologist at all. I suppose there was one there in the background, and making decisions or whatever. I had a lead physiatrist who was great, but there was no detail presented at all. I had no idea what the value was going to be of hydrophilic coating, or that there was such a thing as a Coude tip. Found that out later on when I ended up with a need. And I agree that when I did get connected with, now it's been a series of different urologists as they come and go from the local practice, I have had to educate each one of them to some degree on, the end user's real needs and the end user's real questions.
Yeah, I think you hit it on the head there. And one of the things that we did when we created this, and Lisa and Morgan were both involved in developing this, along with, we've had, psychologists and we've had occupational therapists. We brought the user in as well. We brought individuals that have been catheterizing, was that voice has been missed so often and so long. And we wanted to make sure that the program that we created could be used. Originally we thought, okay, urologists, but the reality is that urologists are not the ones in the United States that are predominantly prescribing intermittent catheterization. It's often a nurse practitioner, a clinical nurse specialist, and then it's handed down to either an RN or a medical assistant to provide the actual instruction sometimes, oftentimes, I should say. So we wanted to make sure that this was easy to use and that it could span any level of education, and that it would be implemented by anyone that would need to implement it, that it really kind of spans that entire educational, hierarchy there.
Yeah, we are seeing in that it's not just urology that is managing patients with IC. There's primary care that manages a lot of these patients that don't have difficulty, and this is not something that they see frequently. So providing guidance for them on how to meet the patient's needs and meet the patient where they're at, and really look at that patient's individual goals and plans. And, you talked about where are they going to be cathing? And I think that this is one of those things that can span multiple disciplines.
Yeah, I'm asking these questions actually in anticipation of the next subject, because I think it's important that our audience understands that there is no set answer, that we're a part of the solution, and frankly, together we have to figure this out. And what I wanted to, maybe before we go on to the next topic, I was going to mention or ask a question of all the panelists here in terms of, how do you counsel practitioners and patients themselves on the evolution or the changing urology of their case? Meaning, my bladder in the first year of my injury is different than my bladder 37 years later. So I'm wondering, Do you speak to that about aging with a spinal cord injury in terms of urology? Is that a topic that's raised with your network of both clinicians and patients?
So very. So working in the urology space, and that's kind of my only area of work. I've been in urology since I became a nurse practitioner. It's really important to me that we have continual follow-up with these folks because the water tract does change, that water channel with chronic catheterization. We're going to see chronic trauma, the development potentially of strictures, enlarged prostate and prostate disease in the male, vaginal atrophy in our women patients and whatnot. So it's important that we follow up with those folks, but it's a very much so an individualized process. I think it's really important to educate not only our team, our clinical team, about changes that come into the market in terms of catheter development and changes into that market, as well as our patients. And it's hard sometimes when they fall out of care. I saw somebody probably a year ago that came into clinic who brought in their red rubber catheters. And I was like, uh-oh, like you're still using this? This tells me you haven't seen anyone in a really long time to get updated on this issue. So it's complicated, but a great question.
Yeah, the patients that I typically see are at the early stages of their injury. But what's really important, like you said, is with the changes, in their body, it's that follow-up. And that is one of the areas that is addressed, with this as well is, ensuring that that patient is followed up. And it guides the provider in scheduling those follow-ups and making sure that we help that patient stay on track. And, just like you mentioned, like hydrophilic and, the changes and, healthcare changes daily as we go. Healthcare is constantly evolving. And what this does is this also, prompts that provider to stay up to date with the new products and devices. Because those are those things out there that we can use to help our patients navigate the different challenges that they have throughout their life.
It's great. I think we'll move on to the next topic, but we'll have lots of time afterwards for more Q&A. But I do want to pose a question to Steve and Bill, and I'm going to ask you this at the end of the presentation. If you could write a letter to yourself within 6 months after your injury, what would you write in that letter about when it relates to your urology care? I'd be curious to hear what you have to say. So we'll move it back to Rachel. Go ahead and take it away.
Okay. So we'll go ahead and move on to the second part of this program. I wanted to go a little more in depth and detail into the incorporating health psychology and intermittent catheterization for patients and practitioners. And again, this was developed by Dr. Sula Wingasson, who is a health psychologist and psychotherapist. And what we're going to kind of cover is why psychology matters for patient care, what empowerment and confident living looks like, how we develop this health psychology informed patient and clinician program, what are the roles for the clinician and the realistic scope of influence, and then what is the actual program and how can this have a change in patient care. So why does psychology matter for patient care in IC? It's not just something you have to do, it's something you live with and something that potentially your whole life can start revolving around. And so it's really important to address it. IC doesn't come without risk, including pain, post-voiding retention and infection and injury, just to name a few. But there's also the psychological risks, including fear, anxiety, sometimes shame. It can affect mental health and has an impact on sexuality and intimacy. And there can be self-esteem impact, including negative self-image. So it's definitely an important area that we need to pay attention to. And all of those psychological impact can have a physical health outcome, and it can affect your ability to live confidently and comfortably. So this program has two main goals. It was really designed to empower and then lead to confident living. And empowerment is the starting block, and it leads to that confident living. What does it look like? Well, it looks like being able to say and feel the following statements. I can catheterize without causing myself harm. I can go to the bathroom without thinking about it. I can make plans that I want to do, and I can feel connected to my partner. So we start with that empowerment phase and we move into the confident living phase. It's really feeling supported and heard from your healthcare professional, feeling like you have a voice. And then when you move into that confident living, it's minimal headspace taken up by toilet related concerns, being able to participate in life without worrying about where you're going to catheterize, how you're going to catheterize, if you can catheterize. And then that helps build upon the self-esteem, uninformed by IC. So this program, again, as I mentioned, was developed primarily by Dr. Sula Wingasson with some feedback as well by Dr. Alicia Hughes, who's also a health psychologist, myself, and Kira McGarity. And Kira is a psychological well-being practitioner. She's also an intermittent catheter user. So it was really important to get her perspective and to hear her story. And we have a really great video on our website if you get a chance to go listen to Kira's video. She talks about some of the struggles, mentally that she had and psychologically when she was struggling to get her diagnosis, and then also with finding the right catheter, finding treatment options, being informed, and how she kind of really got depressed and stayed inside and didn't go out. So if you get a chance, take a look at that at a later time. Right now, we're just going to talk about, how we developed a healthy psychology-informed patient and clinician program, and we use intervention mapping. So we really work to do this. There's several steps. I'm going to kind of just go through each of these here briefly, but we started with a literature review, and we also included patient surveys. That led us to identifying and designing outcome measures to assess the impact. And then the next step was really to identify methods of change using multiple models to generate a coherent program. And then we reevaluated the content with users for validation. Users are really at the heart of the development. That's really kind of one of the missions here at Catheter is forever caring and to putting patients first. And we recognized a need for addressing the needs of a healthcare professional, because as much as we'd like for our healthcare professional to know how to address these needs, our research indicated that these conversations weren't happening. Many healthcare professionals, when they were polled, said that they were afraid to address these issues because they didn't know what to do with the information they uncovered. And even if they uncovered an issue, they didn't have the resources available to aid them in the next steps to help the user to get to confident living. Then we also, in this shared decision-making design, had also sent out 100 surveys to IC users for feedback along the development. And this really helped us make sure that we had a really cohesive program that was taking everybody's needs into consideration. So the role of the clinician is really to be, the trainer. They have the power to empower their patients beyond the provisions of knowledge and skills. They need this training because we heard it again and again. They simply didn't ask their patients about their emotional well-being. They didn't even ask because they didn't know what to do with that information or how to help the patient. Other feedback that we received included they didn't have enough time during their visit. And I'm not sure that we can solve that problem right here, but we're hoping that by having these tools available, it's going to make that process a little more concise and a little bit more, easier to follow. They'll have the tools in their toolbox to go ahead and ask these things, organize their visit, and to give the patient the tools that they'll need as well. There's also a hyper focus on they really just felt like they needed to teach the skill. They needed to teach that patient how to get the catheter in, how to get the urine out, how to get the catheter out, and that was the main focus. So emotional well-being kind of gets put on the back burner. There was a lack of knowledge, and then they also felt out of their comfort zone. So our guide is really designed to be succinct, clear, and easy to adopt. We, again, use that ask, validate, and empower. So it's not just at the beginning to assess where the patient is in that phase, but we also have, through motivational interviewing, ways to assess throughout the entire journey of where that patient is. So to kind of give you an example again of the ask, asking the patient, catheterizing can have a big impact on life and how people feel about themselves. How are you doing? Just asking, how are you doing? Asking them, this can have a big emotional toll too. How are you feeling about it all now? And then the validation example would be, just to validate those feelings. I hear you. I'm sorry. That's really hard. You're not alone. Letting them know they're not alone. It's okay to be upset. And then leading to the empowerment, getting them out of that validation phase into the empowerment is the next phase. I hear how hard it is now. It can get better. Here's something that might help. So giving them these tools, giving them these resources, giving them these modules, giving them the tools so that they can move on. Here's frequently asked questions. Here's a resource where you can reach out to others who catheterize on the Catheter website, and you can hear their stories and how they had challenges similar to what you are going through. So the patient program includes everything that we've mentioned so far, but there's also these 10 modules that patients can complete in their own time, and practitioners can refer to one or all of them. Anybody can access these tools, all of these different modules. They don't have to start at 1 and end at 10. Sometimes they might be, having negative thoughts about their relationship with themselves and need to jump to number 8 first. And then maybe socializing and social context is on the back burner until they feel more comfortable and confident. So you can jump around in these tools. It doesn't have to be done in sequential order. And the goal of this is really to go from, the feelings of pain to being more comfortable, the feelings of post-voiding retention and infection to proper bladder emptying because they have the proper education, to go from injury to safe catheterization without injury, to go from fear, anxiety, and shame around IC to comfortable, confident, and empowered to participate in life, addressing the sexual and intimacy to stable mood and healthy adjustment, preserved intimacy and connection, good self-esteem, and relationships with oneself. So we would like to acknowledge, not only Dr. Alicia Hughes, but all of the IC users that have been so instrumental in making this program successful and validating this program that it is a very solid program and a very good tool. I would like to also touch on, before we move on to the panel with questions, if that's all right, I did change this up a little bit. I'd like to just cover one last aspect that we've created recently that may be of use to anyone that's listening today. Catheter has a new Me Plus companion app. And basically, it's a user-friendly, discreet, convenient way to track fluid intake and urine output. You can set hydration goals and record leaks. You can create customized summary reports that can be shared with your healthcare professional. And you can access all of the, or at least some of the, we're hopefully going to have all of the Me Plus educational tools and support on the app eventually. We have some initial ones. I think, we're starting out small and we're kind of building it as we go, and bringing things over as the need is there. So this is a really great tool just to kind of go through. It's very simple to use. Everyone has their phone. Long gone are the days of completing a diary in the waiting room of the physician's office right before you're going into the waiting room, or right before you're getting taken into the exam room for your physician. It's easy to use. It's very simple. You can track your beverages, the amount of fluid, the type of beverage, if it's caffeinated or not caffeinated, the volume, if you're having leakage, if you're urinating spontaneously. It really has an avenue to kind of capture all of that. So with that, I'd like to go ahead and pass it back to the panel and back to you, Barry, if you'd like to ask a few more questions.
Sure. Before we get back to, by the way, this was fantastic. This is an overwhelming amount of information, and we cannot stress enough to our listeners and frankly beyond into the community, and we will help spread this word. But this resource and the resources that you're providing is absolutely incredible. And I ain't just saying it. It really does make a difference that so many of us are really on our own. And we'll talk a little bit about that and ask some questions there. But I'm not going to ask the question yet, Bill and Steve. I know you're doing your homework on my initial question before we moved into this section, but I want to open up to everybody and talk about the elephant in the room. This is something we all face, and that is UTIs and bladder infection. And I'm watching the chat room as well. And frankly, there's a lot of topics to discuss. I think it would be important. I'm gonna ask all of you, whoever wants to weigh in, to talk first about how one may prevent UTIs first and the various factors that are involved, because it's more than just some things, and we'll get into that. But I don't want to spoil that. And I'll just throw it to everybody on the panel. Anybody wants to jump in and explain, that would be great.
So I think education and talking to our patients, their caregivers, those are going to be Kathleen, helping them, it starts with those initial teaching, and teaching them how to keep themselves safe, how to prevent the infections, and providing them with the information and the knowledge, about how important it is to empty their bladder. And, but our providers that are providing this education need to know what to teach. And that is one of the things, like, with these tools is, we mentioned a lot of times, it is the MAs that are teaching, and, giving them the resources to make sure that we are teaching these topics to help the patient, know about infection prevention and know that, and why it's important to keep up with cathing and keeping your bladder emptied and, preventing the infections way before they even start. So Morgan's shaking her head at me. So I think she feels the same way.
Barry, if you wouldn't mind me jumping in, I have
Absolutely.
the single most important way that I prevent UTIs, and knock on wood, I am not somebody that typically gets on. I can't remember the last time that I did get one, is, coming around to the point of using only hydrophilic catheters, number one, but also having a touch-free catheter insertion with my Convatec General Cath catheter that allows me to insert it quickly, easily, simply, without having any compromise of adding bacteria each time I catheterize. So, essentially that's how I prevent them, by using the proper equipment.
That's a great point. And Barry, I did my doctoral project on UTIs and recurrent UTIs in the long-term care settings, so I could soapbox this really hard. They're so hard, right? Part of it is, I think that providers need to know and understand that our folks who do intermittent catheterization for the long term will become chronically colonized, right? So maybe there's a little bit of bacteria in your bladder all the time, and that's okay, so long as you're not getting sick from it. That is going to contribute to major overuse of antibiotics. And I'm going to argue that primary care, urgent care, and the emergency departments are going to be quick to give you an antibiotic sometimes when maybe you don't need one, right, with that chronic colonization. But for folks who have true UTIs with symptoms, we work very heavy with hydration and appropriate hydration status. Our patients love their soda and their coffee and their tea and really just not enough water. We do utilize cranberry supplementation, probiotics. Occasionally we'll use D-mannose as well. There's some evidence for that in the literature as well. We use vaginal estrogen for our female patients who've gone through menopause. Sometimes we use a drug called methenamine for UTI prevention. So there's a whole list of things. I think if you're having these troubles, I do think that's worthy of following up with your urology provider, even your urologist or your urology nurse practitioner or PA.
Is that information available on either the app or the Convatec website?
Which information specifically? Everything she said?
More got things to think about in terms of how to avoid prevention for UTIs.
Yes.
Yeah.
Yes. Specific to prevention for UTIs, there is information, and it's in some of the literature pieces as well as also in the frequently asked questions.
Hey, Barry, I want to jump in.
Absolutely.
So I just want to add, so definitely like using hand antiseptic, that's really important. Hydration is really important. But something for me that was really important is, and you don't know what you don't know, but I've tried so many catheters over the years, but it used to be that when I would use my hydrophilic catheter, I would insert the catheter, I would drain my bladder, and it would take a little bit of extra effort for me to remove the catheter. Okay. And what I learned over time is that, hey, maybe because it may dry a little bit or it may settle a little bit in the urethra, that it was causing some micro tears. So I was actually, I think there's a correlation. You clinicians can say this. I think there's a pretty strong correlation between those micro tears and UTIs. And so for me, once I found the catheter that wasn't causing as many micro tears, that led to fewer UTIs. And that's just my personal experience.
I'm just going to remind the audience that please feel free to add into the chat room any questions that you might have, and we will be listening. And if not, we can also raise those by just unmuting you at the time, if that's easier for you. Another question back to all of you is, maybe you've talked earlier about regular checkups and such. Maybe you can stress the importance of some type of regimen of getting annual or biannual urodynamics and ultrasounds on kidneys, if you could do that. And then secondly, I'll just throw this to Rick, how important it is and what's the impact of not carrying about UTIs and how that could affect your renal system and your kidneys in particular.
For our folks clinically that have that require self-catheterization, we do an annual renal ultrasound to ensure that we're not having sort of that back pressure up into the upper urinary tracts. We're not causing hydronephrosis of the kidneys, making sure that bladder is being emptied on a regular schedule and that we're not causing long-term kidney damage. I think that's really important to double check that with your patients. We also like to check renal function, which is also typically being done with folks with their primary care provider as well. So I won't often check that lab work if I can find it in the chart and things like that. But I do think that's important. And we typically only do urodynamics when we're seeing like a big change, right? So is there unexplained hydronephrosis for some unknown reason with appropriate catheterization? Are we seeing more urinary tract infections and we can't really figure out why? But at that point, we're also performing cystoscopy. So our physicians are looking through that water channel and into the bladder to make sure we're not missing something as well.
Thank you. Any other comments from the panel? I'm going to move over now to Ryan. Had a question in the chat, and he asked, is there more research being done on bladder cancer and what products, for example, the use of plastics? I know that there was a movement for a while there, and I don't think Convatec's involved with that product, but there was a ban on certain plastics being used in some catheterization. Just wanted to know if you have any comments on where the industry is on that and this relation to cancer.
I know that there's definitely research that's being done. I don't have enough information available today to really speak too intelligently about it, other than the fact that I see the articles, I see there's clinical trials being done to determine, bladder cancer courses. And, Convatec, like all of probably the manufacturers, their main concern is not only the environmental impact that it can have, but also health and safety of individuals that catheterize. That's kind of at the forefront of everybody's mind is, we want to make sure that our products are safe and effective. So yes, it is being done, but I don't have a lot more information that I'd be able to share about that specific topic. I don't know if any of my other colleagues have any.
Steve, you had a comment on that. Maybe you can just briefly speak to that.
Yeah, briefly, but I just know that, for a while there was a big fuss on DEHP. It was in some catheters, and I don't know the causation or correlation type relationship, but there had to be something there because I think eventually most, if not all manufacturers moved away from that. I think it's a plasticizer or something like that was used in a lot of catheters. So,
I think because UTIs are much more common, prevalent issue, and it's such a widespread problem, and it has such lasting impacts and sometimes can result in death, that's really kind of been more of the focus, is the UTIs and prevention of UTIs, urethral trauma, causing issues with the urethra in general has been more of a focus. At least I know it has been here at Convatec.
And Bill had actually a question back to Morgan. Maybe you can ask it, Bill.
I was just typing some follow-up. So yeah, Morgan, and thank you, Barry, for bringing the topic up of annual testing. So wanted to narrow it down a little bit more to you, Morgan. So in the absence of significant problems like frequent UTIs, indications of strictures or any other complications, us wheelers are just wheeling around. Everything's great all year long, and you're going to have your annual checkup with your urologist. Are you recommending that ought to be accompanied by an annual urodynamic study, including renal sonogram? Because my urologist is specifically playing that down as not really important to do that.
So I think it kind of goes one of two ways. So no, we don't typically do annual urodynamics testing. We don't typically do that, but we are typically going to image the upper urinary tract, because how do you know whether or not you have silent obstruction, right? So I have patients who say, oh yes, Morgan, I catheterize just like I'm supposed to. I do all the things right. And then my patient ended up septic in the hospital with major bilateral hydro. So was that a cause of the UTI, or maybe we weren't really catheterizing the way we were supposed to? At this point, who knows? But we're going to check. We're going to keep a follow-up on that and check. Those kidneys are pretty darn important. We don't want to hurt them.
Got it, thanks.
I'm going to go back to my question, guys. I asked you at the end of the last section, and because there's so many people that are listening today, and I hope they're learning from them, you know, on the standing on your shoulders and the experience that both of you bring to the table. Love to hear about really your journey, and what would you tell your old self of all the things that you know today about urology and maintenance?
So what I would tell my old self back in the day, and tell them early and often, is that you know, getting a good handle on safe and effective bowel and bladder management are the two things that open up the entire rest of your life. You can go on and do any number of things you want to choose to do, school, work, travel, work, travel. It took me a little while to get comfortable doing, you know, independent work, travel. All of that became possible as soon as appropriate bowel and bladder management was accomplished. It all depends on that.
And you, Steve?
Yeah, I would say trial and error is just part of the part of the process, and it gets easier with time. The second thing is you are your own best advocate, so speak up. Don't be afraid to ask questions. Lastly, listen to your body. I know whenever I was injured, I had a Foley in place, and I was sick constantly. And it wasn't until I spoke up after learning from others that were in and out cathing that, hey, I could actually in and out cath, that this was an option for me. And my life got much better as a result of that. And of course, finding the right product, that was a big part of the process as well. But again, don't let a momentary failure deter you. Keep trying to work to figure it out. I promise that makes all the difference.
Again, you are your own advocate, and we want to thank our friends at Convatec for an incredible sharing of information, but more importantly, on how you put it together. I think it was well thought out, and you covered so many things that really captures our journey. And frankly, we all do admit that with the days of early release to the wild, as I like to say, from rehab, there's so much we don't pick up organically anymore. And now with these type of resources, it's imperative that we educate ourselves to be the best advocates. Gentlemen, you were fantastic. Thank you for sharing your journey. I know it's always personal, but it's so important that guys like you share it. Ladies, you guys were amazing. You're great professionals, and we look forward to seeing what kind of help we can provide going forward, and how we can connect our community to you guys. Thank you very much, and thank you for being great partners today. Greatly appreciated. Take care, everybody.